Thanks for joining us. This is a video about external otitis, external ear infection. This is something that will happen on occasion with either bacteria or fungus, and Valerie has been kind enough to let us make a video, but we can't show her face because she's shy. So we need to look at what we're seeing. It's a lot of bacterial exudate inside of the external ear canal and on the tympanic membrane, or the eardrum. Now, you already tried treatment with just vinegar. And that was able to actually clean it up quite a bit compared to what it looked like when you first came in.
Yes.
There was a lot more material in the ear, especially on your right ear.
Good stuff.
Now when we look in your right ear, there's much less of that
Yes.
good stuff, as you
Yes.
put it.
Yes.
And the symptoms are that it's itchy and what else?
A little hard to hear.
And is that improved with just using
Muffled.
vinegar?
Yes.
It is?
Yes.
Okay. So we're going to finish it off better. We're actually going to step up the game to using a type of antibiotic. It's a little more expensive, not as expensive as that corticosporin you saw that was like $60. It's about half that much.
Oh, excellent.
Called Floxin. It's a type of antibiotic that will work on bacteria that's in the ear canal, and we want to recheck it in just a few days. So given that this is a Thursday, Monday would be, the earliest we could actually check it and see that it's doing what it's supposed to.
Sounds good.
Yeah, if we're not getting good cleanup of this,
Uh-oh.
then we're going to have to refer you to an ear, nose, and throat specialist. I don't anticipate that based on what yours looks like.
Okay.
Now, in really severe cases where there's a lot of swelling of the ear canal, which can happen with this, we'll actually have to stick in a little wick of gauze to help the drops get in. But yours is open enough and clear enough that we can see all the way down to the tympanic membrane on the left side and almost on the right side. Close enough that I think the drops will do it.
Excellent.
So you can get significant improvement in just a few days with this.
Very good.
And what you see there, that white flaky material, some of the exudate from the infection, right at the external meatus, or the opening to the ear. Hey guys, sorry to interrupt Valerie's otitis externa. We'll get right back to it. But first, 2 announcements. One is that we changed our upload times on YouTube. So now we upload videos at 6 p.m. on Wednesdays and Fridays. And the other announcement is that you can get bonus content by signing up for our newsletter at auburnmedicalgroup.com. Sign up for the email newsletter and you'll get some pictures of follow-up of some of our most popular cases. Now let's get back to Valerie's otitis externa. We're going to take a look in your right ear.
How is it?
It is looking yellow. There's some yellow wax, and there's still some white color and white material in there, but much improved over what it was. So we're going to keep using it for a full 7 days. This one, I can still see some evidence of it also on this side too. And then when we look at the eardrum, it's not quite as nasty. It doesn't have the big bumps it had before, but it still has some material on it that we need to clear out. And you're doing fine. We don't have to put in any kind of wick to get the medicine in there. I can see the eardrums on both sides, so we just need to keep doing it.
Okay.
So I'm glad you came in this time though, so that we can see that indeed is working.
It's working.
Yep. Valerie, you're getting better.
Yes.
We probably won't have the last check on video, but we will confirm that yes, indeed, it is clearing up. And the medicine with the ofloxacin works. You're kind of unique in that you got the kind for the eyes for ears because your pharmacy didn't have it for the ears, but it works anyway. The ofloxacin for the eyes works for the ears. So we'll have everybody be sure to subscribe if you haven't already, and be sure to share with your friends that might be suffering from otitis externa or want to learn about this. Until next time, this is, we'll call her Valerie, and Dr. Mark Vaughn telling you, stop smiling to stay in good health.